The real question, does regular masturbation prevent or reduce the risk of cancer? I'm Dr. Laura Stone. How often you ejaculate, even in your 60s, 70s, and beyond, can impact your prostate, your sperm quality, and even your emotional well-being. And for some men, prolonged abstinence may actually carry risks that aren't often discussed. A study conducted by researchers at Harvard and published in European Urology found that men who ejaculated 21 times per month, on average, had up to a 31% lower risk of prostate cancer compared to those who ejaculated just 4 to 7 times per month in adulthood. That's a significant difference, and one that challenges a common belief held by many older men, that saving it is better for your health. In fact, moderate ejaculation frequency appears to help reduce congestion in the prostate, potentially supporting long-term function and comfort. And this isn't the only finding worth noting. Other studies show that when men go longer than 2 to 4 days without ejaculation, their sperm volume might increase, but quality declines. Now, if you're not trying to conceive, you might think this doesn't apply to you. But sperm quality is one window into your body's overall reproductive function, and it often reflects how well your system is managing inflammation, hormonal balance, and circulation. Here's another common question. Does abstaining boost testosterone? It's a fair question, and it's been studied. Short-term abstinence may cause a slight rise in testosterone, particularly after about 7 days. But in men over 50, those changes are usually too small and inconsistent to matter. They don't lead to lasting hormonal benefits or higher vitality. So while the idea sounds appealing, save it and your testosterone goes up, the science doesn't fully support that, especially as you get older. And finally, there's the emotional and mental side of abstinence. Some men report improved focus or self-discipline. Others feel more anxious, distracted, or even irritable, especially if the abstinence is driven by shame or external pressure, not personal comfort. Let's take a closer look at what happens inside your body, specifically your prostate, sperm quality, hormones, and comfort, when you go long periods without ejaculating after 50. The first area to consider is prostate health. The prostate is a small gland just below the bladder, and it plays a key role in producing fluid for semen. When men ejaculate, the prostate contracts to release that fluid. But when ejaculation doesn't happen for long stretches, the gland remains relatively inactive. This doesn't cause immediate harm, but over time, reduced activity may lead to something called prostatic congestion. It's not a disease, but it can create subtle inflammation, a sense of fullness, or even mild pelvic discomfort in some men. Some urologists believe that regular, moderate ejaculation may support healthy circulation and fluid turnover in the prostate, especially in aging men. This might explain why higher ejaculation frequency is linked to lower long-term risk of prostate cancer in multiple studies. Now, let's talk about sperm quality. Some men think of abstinence as a way to store up or save sperm. And it's true, if you abstain for several days, volume often increases. But the quality of that sperm, how well it moves and whether it's formed properly, tends to decline after about 2 to 4 days of abstinence, which has been shown in multiple studies. The longer the abstinence, the more likely the sperm will be sluggish or misshapen, especially in older men, whose testicular function is already under age-related pressure. While you may not be trying to conceive at this stage of life, these findings still matter, because sperm quality often reflects broader reproductive health, inflammation levels, and hormonal balance. So even if sperm count increases slightly with abstinence, it doesn't necessarily mean your reproductive system is functioning better. Let's move to the topic most men are curious about, testosterone. There's a long-standing belief that abstaining from ejaculation will make your testosterone build up, giving you more energy, more strength, and greater sexual drive. But here's the truth. Several well-conducted studies show that while short-term abstinence, around 7 days, may raise testosterone very slightly, the effect is small and temporary. And in men over 50, those tiny hormonal shifts usually don't make any meaningful difference. More importantly, ejaculation itself doesn't drain your testosterone. If your testosterone is low, it's more likely due to age-related decline, sleep issues, metabolic factors, or medications, not how often you ejaculate. Next, let's talk about physical discomfort. This is something a lot of men don't expect, but some experience it, especially after prolonged abstinence. A condition called epididymal hypertension, often referred to informally as blue balls, can occur when arousal builds up without release. It's not dangerous, but it can feel like a dull ache or pressure in the testicles or groin. It typically resolves on its own, but it's worth being aware of. Another rare but possible side effect of long-term abstinence is retrograde ejaculation, when semen flows backward into the bladder instead of out through the urethra. This is more common in men with certain medications or nerve-related issues, but prolonged inactivity may contribute in some cases. Finally, we need to acknowledge the emotional and psychological effects. Every man's experience with abstinence is different. Some report feeling clearer, calmer, or more spiritually grounded when they abstain. Others feel irritable, anxious, or disconnected from their body, especially if abstinence feels forced or unnatural. It's not just physical. For many men, ejaculation is tied to emotional regulation, stress relief, and even self-acceptance. If abstaining leaves you feeling more in control, that's something to honor. But if it leads to frustration or shame, especially if driven by rigid rules or social trends, it may not be serving your health. This is where the idea of listening to your body becomes crucial. If you've been abstaining, whether intentionally or not, and wondering whether it's helping or hurting your health, here are a few key takeaways I want you to remember. First, there's no evidence that regular ejaculation is harmful to men over 50. In fact, multiple large studies, including long-term data from Harvard, suggest that moderate, consistent ejaculation may lower prostate cancer risk, support healthy circulation, and help reduce prostate congestion. This doesn't mean you need to hit a specific number every month. It simply means that ejaculation is a normal, healthy function, even as you age, and for many men, maintaining it in some form supports both physical and emotional well-being. Second, your body doesn't store up sperm like fuel in a tank. It produces and recycles continuously. When you don't ejaculate, your body gradually reabsorbs and uses sperm, a normal process. But over time, very long periods without release can lead to stagnation in the prostate, subtle inflammation, or a sense of pelvic fullness. For some men, this shows up as discomfort or decreased urinary flow. For others, it's just a vague sense that something isn't working the way it used to. Third, if you've been abstaining in hopes of raising testosterone, it's worth resetting your expectations. Most of the evidence shows that short-term abstinence can cause a very small increase in testosterone, but it's not enough to meaningfully impact energy, mood, or libido. Especially not in men over 50, whose hormone levels are already more influenced by sleep, weight, medications, and overall health. If testosterone is something you're concerned about, that's a conversation to have with your doctor, not something to manage through abstinence alone. Fourth, if abstinence is starting to feel like a chore, or if it's making you feel anxious, irritable, or disconnected from yourself or your partner, it's okay to change your mind. You haven't failed. You're simply listening to what your body is telling you now. Fifth, there's no single right frequency. Every man is different. Some feel great ejaculating once or twice a week. Others are comfortable with more or less. What matters is balance and how your body responds. That said, a moderate frequency, about 2 to 4 times per week, is often cited in studies as a range associated with positive prostate outcomes and emotional stability. Now, if you've chosen to abstain for religious, spiritual, or deeply personal reasons, and you feel grounded and well, that's valid too. This video isn't here to tell you what's right or wrong. It's here to equip you with facts, so you can make informed choices that support your long-term health. Just keep in mind that ideologies like NoFap or abstinence challenges, which often circulate online, were never designed with older men in mind. They're usually aimed at younger men navigating a very different stage of hormonal and emotional development. What's helpful at May 25th not apply at 65. So always consider your age, your biology, and your emotional needs when making decisions about abstinence or sexual rhythm. And don't be afraid to discuss this with your doctor. These are legitimate health topics, not just personal or private ones. And talking about them openly can lead to better care, better comfort, and better peace of mind. To summarize, ejaculation is a healthy, normal function, even after 60. Abstaining for very long periods may slightly increase prostate cancer risk in some men. Testosterone isn't meaningfully boosted by abstinence. Sperm quality actually declines with long abstinence. Emotional effects vary, so listen to your body and don't feel pressured by trends. And most importantly, don't make decisions about your health based on fear, shame, or myths. Use science, trust your experience, and reach out to your provider when something doesn't feel right. If this video helped clarify things, consider subscribing for more honest, evidence-based guidance on men's health after 60. And as always, talk to your doctor before making any changes to your lifestyle, diet, supplements, or habits. And always remember asterisk. All information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.